Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video, I want to discuss anterior pelvic tilt. Okay, anterior pelvic tilt is from the side when you look at somebody, if their butt is sticking way out and their stomach's hanging forward and they have this increased curvature in their lumbar spine called a hyperlordotic curve. So again, not being straight this way, but the butt being back and the stomach being forward, that's called anterior pelvic tilt. My hands are my pelvis, it's tilting forward like this. So if I tilt it forward, okay, now I may not be doing that on purpose, but if you look at someone and you see that tilt, that means, and we look at the different muscles involved, the rectus abdominis, the abdominal muscles, if those aren't firing properly, it's going to allow the pelvis to tilt forward, okay? So now it doesn't mean necessarily that the abdominals are weak. It means they're inhibited and not doing their job. They're not being able to perform the tasks they were designed to perform. So if we had inhibited abdominal muscles, we'll have that forward tilt, or it might be because our quadriceps, the muscles in the front of your thighs, are too tight. If they are spasming or tight, they're going to also pull the pelvis down in anterior or forward, okay? Now looking at the back side, again, there are other muscles involved too, but I just want to hit some of the key ones. Okay, so if the pelvis is being tilted forward, it could also mean inhibited hamstrings, because the hamstrings are not pulling the pelvis in the position it should be in, and them not firing allows it to come forward like this. The other thing would be if the back muscles across the lower back are tight, they're going to pull the pelvis up, and then therefore they could be the major cause turning the hamstrings off. So again, a lot of people, well, I've got tight hamstrings. Well, but why are they tight? Well, I run all the time. Well, you can have people run all the time and their hamstrings are functioning just fine. So the real question is looking at, again, I always say, think of the spinal column like an electrical control panel on the side of your house. Here in Arizona, they put our control panels on the side of the house out in front of the gate where anybody could walk by and open it up and just shut off all your electrical. So think about that when we think of your spine. When I have a new patient come in, I say, hey, this is your spinal column. Think of it like an electrical control panel, and we open it up, and inside we see all the vertebrae, and those vertebrae are circuit breakers. So when I go through and I do all the tests, if your hamstrings are firing, we're looking at the myotomal distribution. Think of it like a wire going from your control panel up through the attic, wherever it goes to get into your bedroom, into your kitchen, wherever it goes, and then that circuit can be overloaded. A good example is vacuum cleaners. They're setting these new circuit breakers in different cities due to mandates that they trip at an easier level. Vacuum cleaners are a great way to trip the breakers, and it's very frustrating. But when that happens, you go outside, you reset the circuit, and then everything will work again. Now, if you live in an older house, you may not have those issues, but the newer circuits are tripping easier. They're designed that way. So with our bodies, if you stress your abdominals or you stress your hamstrings too much and it trips that breaker, well, then what we need to do is go in and reset that breaker. So those things can be tripped from emotional, chemical, and structural trauma. So, if you're doing an exercise and you overstrain it, that can shut things off. If you're eating a bunch of garbage and not eating well, that can cause too much chemical stress. And the last one is emotional stress. I had a buddy in school, we were together in school, and when we'd have finals week or finals weeks, we'd have lab finals one week, and then we'd have the regular classroom finals the next week, so it was 2 weeks of finals. His low back would go out. And he didn't have low back pain when it wasn't finals week. And it would get so bad he could barely get up out of a chair. As soon as finals were over, he was fine. So emotional stress, whether someone wants to acknowledge it or not, is a huge component. And that's where exercise is so awesome. Now keep in mind, it has to be proper exercise. If you're doing deadlifts and you can't do low back extensions, you shouldn't probably be doing deadlifts yet. Get yourself in good enough shape. Get a personal trainer. Get someone to help guide you and to teach you so that the things you're doing are helping you instead of hurting you. So again, anterior pelvic tilt, we don't want to see the pelvis going forward. It will cause low back tension, okay? Stretching those abdominal muscles, causing tight quadriceps, turning off or inhibiting the hamstrings. And again, which one was first? Well, we got to clear it out. We got to clear it out whether it was a cause of emotional, chemical, or structural stress. We got to reset those circuits, get your body to hold that, and get your pelvis functioning properly so you're not stressing and straining the joints of the spine, putting too much pressure on the intervertebral discs that are in between every single vertebra in your spine. And we don't want to see those get degenerated. You know, we all heard it, degenerative disc disease, degenerative joint disease, leading to rot and decay, AKA osteoarthritis. And we don't want to see that. And, you know, I see it so much in the practice. People come in where they've had these chronic issues and they have not put their health at a high enough priority until, you know, they can't get up out of a chair or they end up on the floor for a day. We'd like to see you before that happens. So if you're someone here, we'd love for you to come in and get checked. If you're someplace else, find a chiropractor in your community, get your spine checked, and find out what's working and what isn't. And just please have a fantastic week.